The National Sports Club of India in Mumbai, one of the biggest spaces for events in the city. In a matter of 2 months, it has gone from hosting concerts and film awards to hosting COVID patients, 360 of them. In the next 2 weeks, it will graduate into one of Mumbai's largest COVID treatment facilities with 700 beds and 40 ICUs. In a city starved for space and beds, everything is kosher.
हेलो, आपका नाम बताइए। एडमिट कब हुए आप यहाँ पे?
At the NSCI isolation facility, behind a glass partition, inside a small cabin, doctors checking parameters of COVID patients.
टेम्परेचर लीजिए ना।
Without touching them or breathing air with a heavy viral load.
गुड मॉर्निंग सर, नाव सांगा तुमचं?
They converse with patients on phone, teach them how to take their blood pressure, temperature and sugar levels.
एकदम सही है आपका टेम्परेचर। आप ये ऑक्सीजन का लगाइए ना प्लीज अपने हाथ पे, यहाँ पे ऐसे लगाइए। वो व्हाइट कलर का बटन है ना, वो बटन दबाइए आप यहाँ पे कौन से बेड पे हैं?
Dr. Diyashali Parekh was studying for his MD entrance exam when the pandemic invaded his city. He has volunteered to be here.
Okay.
And this is my own area. I live very close to here. So I feel very strongly about being here and helping here. Along with teaching the patients about taking their vitals and everything, one of the major aspects is just counseling them, their anxiety, their fears. We have young patients, we have cancer patients. Of course, we do get emotionally invested. But even though we're really happy to speak to them, we're even happier when they can go home and they can resume their normal lives.
बाकी सब आपका एकदम नॉर्मल है।
Dr. Parekh hasn't gone home in 5 weeks. A team of 50 doctors, nurses and IT professionals run the NSCI Isolation Center. Most are volunteers with little or no experience in infectious diseases.
आपका नाम मैंने लिस्ट पे डाल दिया है, आज ही हो जाएगा।
Dr. Mufazzal Lakhdawala, the man in charge of the facility, is Mumbai's best-known bariatric surgeon with a thriving private practice. The BMC was looking for someone to take charge and he put his hand up.
Being a doctor, I could not just lie at home and watch whilst the whole city was burning, especially my Mumbai and Amchi, Maharashtra. And I just could not see people dying without me having to contribute something to this war and this fight. And that made me very restless, very sleepless. I was a private doctor, I was a surgeon who was probably not supposed to be on the forefront. But I decided to come out and try and help. In private practice, I was treating only probably the elite lot of Mumbai, from everybody who had a name or probably who could afford me, to now treating people who were the poorest of the poor, people from the slums. So they had a different mindset. And when you had to treat them in an epidemic where they were extremely scared, the first thing I got on the forefront was to take away the fear. I told them they were not going to die. Okay, I went out and actually put a hand on their shoulders and said, "Ai tumi marna nahi."
Dr. Lakhdawala says while it was imperative for him to save all his patients, it was equally important to keep his doctors safe.
I said, not only do I have to protect my patients, but I have to most importantly protect my doctors. I started with a team of 7 doctors and 24 nurses because that's all I had. But I had to save 500 lives. So what I did is I created contactless safe clinics. Now the contactless safe clinics actually wherein a doctor sitting in the comfort of his AC room with a HEPA filter there and is actually consulting a patient across the screen, wherein we've got 500 patients sitting in front of us, one coming at a time, and talking to us through phone so the privacy is maintained. This actually made the patients very comfortable because they could talk to us at length, discuss their problems without seeing an overbearing image of a doctor in a hazmat suit.
World over, doctors and other frontline medical workers have fallen prey to COVID-19. In Mumbai, there is no official data on how many doctors or nurses or other medical staff treating COVID-19 patients have actually tested positive for the virus, but a rough estimate puts the number at 500. It is this one big fear, the fear of being infected, that is keeping most private practitioners away from COVID duty.
आप कोविड से लड़के विक्टोरियस हो गए हो और आपको जो मन में है ना कि अभी बच्चा है कोविड में पैदा हो रहा है तो उसमें कोई डरने की बात नहीं है। बच्चा जब भी पैदा होता है बच्चे को बहुत इम्यूनिटी रहती है.
Dr. Neeta Varti is a gynec surgeon. She says private doctors like her are ready to volunteer, but fear is keeping them away.
कोई तकलीफ नहीं है आपको, आप दवाई बराबर खा रहे हो, पेट में कोई दर्द नहीं है. The main fear was that how do I protect myself and how do I protect my people while I want to help. And somewhere right from the time that we take the Hippocrates oath, we are committed to saving lives. So we wanted to save lives and save lives of the healthcare workers who are working with us. So our concern is also because one healthcare worker tests positive, there are others who will be quarantined and there will be hundreds of patients who won't be treated by that. Reshma, how are you feeling now? अच्छा लग रहा है?
Dr. Varti has been treating and counseling Reshma Khan, who is 7 months pregnant. She puts her on the speaker for a quick chat with us.
मुझे ना पॉजिटिव रिपोर्ट लेके नहीं जाना है बाहर, मुझे नेगेटिव रिपोर्ट लेके जाना है ताकि मैं मेरे सोसाइटी में जो प्रॉब्लम है वो फेस ना करूं.
बेबी के लिए तो डर नहीं लग रहा कि कोविड और बेबी प्रेगनेंसी भी है तो कॉम्प्लिकेशन है थोड़ा, तो उसको लेकर
लग रहा है जब भी नेगेटिव रिपोर्ट का वेट कर रही हूं मैं.
Thank you, Reshma.
There is fear, says Dr. Varti, but there is also kindness that she encounters every day.
You have really cooperated, taken medicines, become very comfortable. You have helped other people. We saw that the patients were so eager to help. There were some patients who were not symptomatic but here only because they were positive and they could be as a source of infection to others. Slowly they started becoming a part of our health force inside. They started teaching people. They started keeping a lookout for other old people who may not. So there are times when people say, the next bed has a 70-year-old, he can't walk. Just wait, I'll get him. When they come here, they will help an old lady or a pregnant lady put the blood pressure machine and read it for them because it is done across a screen. So that is how slowly they become a part of our family.
COVID-19 has pushed the world on a steep learning curve. One of the biggest lessons, every bed, every ICU, every doctor, and every healthcare worker counts. Keeping them safe gives the world a fighting chance. With PH Rajesh in Mumbai, I'm Shreya Dhondia.